Aloha, this is Dr. Dornicia Carter, your Dallas Skin Doc, coming to you from the beautiful shores of Waikiki, Hawaii, and I'm coming to give you a dose of your skin in a minute. First thing I'd like to tell you today is, obviously out here we're next to the beach, we need a lot of sunscreen. So I want to make sure that you are up to date with everything that you need to know about sunscreen these days. First, we're a little bit closer to the equator right now, aren't we? But that doesn't negate the need for sunscreen year-round, from the poles all the way to the equator, even on sunny and cloudy days, and you'll need it year-round. I've even had patients ask, do they need it during the winter versus the summer, and the answer is yes. So the sun is known, it's proven to make the incidence of skin cancer more frequent, and it's known to make you age faster, and who wants to age, right? And so what are the types of sun rays that are out there? Well, there's UVA and there's UVB. UVA rays, in a simplistic fashion, are for aging. UVA rays cause aging. UVB, on the other hand, cause burning. When you look at SPF ratings, what does it mean? SPF refers to how much longer you can get in the sun without burning after using that product. So if you have an SPF 15, you apply it, maybe without it you would burn in 10 minutes, but theoretically an SPF 15 would allow you to burn until, would not allow you to burn until about 150 minutes later. I hope that makes sense. SPF, however, only addresses UVB, burning. It does not measure UVA very well. So when you are choosing a sunscreen, you want to choose something that says SPF 30. You want it to say broad spectrum so that it covers UVA and UVB rays. And you want something that says that it's water resistant. Water resistant doesn't mean that you apply it once and it lasts all day. It means that about every 2 hours, especially if you're in the water, you want to reapply. Furthermore, when you get out of the water, you come off the beach and you sit down, you want to make sure that you are reapplying your sunscreen after toweling off. That's a common mistake that I've seen right here on the beach, and I've seen very, very frequently in my clinic. So you want to reapply that sunscreen, you've wiped it off essentially, and so definitely take care of yourself and take care of the kids that are around. For those with sun-sensitive disorders, I would recommend that you choose something even higher than SPF 30. Most people don't apply enough sunscreen to achieve the protection listed on the label. They apply maybe 40 to 50% of what they really need. So you want to make sure you're applying enough, which for the entire body is about an ounce. If you're sitting on this beach, you want to apply an ounce every 2 hours. That's a lot of sunscreen, and most people do not achieve that. Get a higher number. Theoretically, you'll get a better protection, and there's no wrong with doing that. Now, when you get to those really high numbers, there really is no reason to go up to SPF 100 or 70. So SPF 30 at a minimum, but 50 or 60 would also be just as fine. And if you're really sensitive to the sun, go for the higher numbers for sure. What are the ingredients you want to look for? So again, SPF measures for UVB, and so the main mineral ingredients are titanium dioxide and zinc oxide. Those do not really protect you from UVA rays. They protect you better from UVB. So you want to look for other ingredients that are in there, and I know that there's a lot of concern right now as to whether you absorb some of these chemicals. And there was a study recently that looked at avobenzone and oxybenzone and octinoxate, and looked to see how much, after applying it 4 times a day, you absorbed into your system. And while some of these numbers were high and somewhat alarming, we know for sure that sunscreen protection or sun protection is associated with reduced incidence of skin cancer. We know that sun exposure isn't associated with aging, and it's associated with higher incidence of sun-induced skin cancers. And so there's no reason to defray using sunscreen right now. I think that it's very important that we continue to do that, and trust and rest assured that we as dermatologists are looking into this, taking it very seriously, and that we're looking into what these absorption levels mean. In the meantime, I'll continue to apply my sunscreen. There are a couple of sunscreens that I really do love. I think that Neutrogena makes an awesome brand. Their Ultra Sheer line, it goes all the way from SPF 35 all the way to a 100. My mom even brought a 100 to this trip. So other ones that I like Banana Boat, Blue Frog. Oh no, I messed that up. So Blue Lizard. So what kinds of sunscreen should you use? So a very good one that we brought on this trip is Neutrogena Ultra Sheer. It looks very good on all different hues of skin, and it's the one, again, that my mom bought on this trip. It comes in a spray format. You can put it on as a cream, and they also have a number of sticks available to make it very, very convenient. Another one that I like is Blue Lizard. Very, very good protection. Some of them are better as far as melting into darker skin types than others, and I'll make sure to review those on a different episode. A third one that for the ladies, I really like the Laura Mercier 30 primer, which you can find anywhere that sells Laura Mercier. It's amazing, and I put it underneath my makeup. It doesn't show up. It really, really provides me that primer that I need to keep my makeup in place, but also provides that sun protection without being too heavy. Now, some people ask me what kinds of sunscreens what kinds or what format of sunscreen should I use? Well, they come in creams, sprays, lotions, gels, sticks, lip balm, whatever you want to find. And I personally like, whatever it is that you'll use. If you find a format that you're just not using, you don't like the feel of a cream, you prefer a spray, you don't like the spray, you'd prefer to smooth it on with a stick, hey, I'll take it. With that said, probably better to use creams or a stick or something that you apply, because it goes on a little more thickly and evenly than a spray. But again, if you don't use it, doesn't matter how good it is, it's not going to work. So in conclusion, things that you need to know about sunscreen. First, choosing a sunscreen is very, very important. Wearing it year-round, cloudy and sunny days, and making it a consistent part of your routine. Next thing, choose something that's an SPF 30 or higher, and something that says that it's water resistant, and anything that it is that you will actually use on yourself and your family. Lastly, I want to remind you to reapply every 1 to 2 hours, especially if you're getting wet or if you're sweating. And I want you to make sure that you are reapplying every time you towel off or go inside to get something to eat and you towel off. You want to make sure that you're reapplying that product to your skin. Well, with that said, that is your Dallas Skin Doc's Skin in a Minute. This is Dr. Dornicia Carter signing off, and it's been a pleasure to speak with you today, and I look forward to teaching you more about your skin. Have a great day.